I'm Doris Hansen. Today we're in Orlando for ASH 2025. I just presented on predictors of early relapse following ciltacabtagene autoleuce to inform risk-adapted therapies for multiple myeloma. This was a multi-institutional collaboration, and the goal was to identify predictors of early relapse in patients with inferior survival in patients with relapsed refractory multiple myeloma. It was a cohort of nearly 600 patients, and essentially we identified that patients who have high-risk features, such as those with functional high-risk disease, those with a new definition of high-risk disease by International Myeloma Society and International Myeloma Working Group, and extramedullary disease, have inferior outcomes and are independent predictors of survival. We also did other analyses because sometimes patients with early relapse cannot be identified a priori with traditional high risk. We identified that a predictor for relapse within 18 months of cilta-cel was functional high risk and IMS-IMWG high risk. And in an extended time modeling, or Cox modeling, basically showed that patients who have functional high risk and IMS-IMWG high risk more likely to relapse within 18 months of cilta-cel, but not beyond 18 months. We also identified that the magnitude of association for extramedullary disease was similar across time points, essentially noting that extramedullary disease is a very high-risk feature in myeloma. And lastly, we really do hope that these findings help inform risk-adapted therapies, whether that might be consolidation, maintenance, intensified bridging, while avoiding overtreatment in patients with standard risk or durable responses.